Hello everyone, you are watching ITV Gold and I'm your host Aditi Lamba. Thank you for joining us on the special report this hour on COVID-19 coronavirus pandemic. Joining us right now from New York City, we have with us Dr. Janish Kothari. Thank you so much for being with us here on ITV Gold, Dr. Kothari.
How are you doing?
Great, and it's so nice to have you here. I know you're in New York City, we're in New York City, so my first question to you has to be, today is National Doctors Day. Happy National Doctors Day. How are you doing today?
I'm doing great, and thank you for that introduction. I really appreciate that. And yes, it is National Doctors Day, and everywhere I'm going throughout the hospital, people are wishing me, even in tough times like we're having right now. So I'm in a very privileged position, and I'm very humbled to be here and just doing the work that I do.
Yes, and it's so great to have you. We love having young South Asian medical professionals. And again, I really appreciate you for your effort and for your time. You know, beginning this interview, I have to ask you, this is my first question to every single doctor. At this hour, when we're in the third week of this pandemic, what is your strict advice to our audience, especially on social distancing? I have to ask you on that.
So my advice for the viewers is to pretty much continue practicing this social distancing because, as far as we know, this is the only proven method to reduce or slow the spread of this disease.
Right.
It kind of seems hard and people are going insane about having to stay home and stuff. But there's only so much me and my colleagues can do within a hospital setting. And I think that the American people and just people in the community have a role to play as well in helping us reduce the spread of this illness and we can't do it without their participation.
Yes, and did you ever anticipate this issue of COVID-19 to get to this extent? I have some numbers for you right now. This is our latest updates as of a Monday. About 4 p.m. I have about 155,000 cases in the US. There are over 2,800 deaths. Doctor, I have to ask you, as a medical professional who has, who's really working in the field, you are a, prominent cardiologist of the area as well. Have you seen numbers such as this, and were you expecting numbers to this extent already?
So when this first started back in, let's just say December, when we were reporting it, when we were getting the reports coming from China, initially nobody kind of could anticipate that it was going to be, I guess, where it is now. Just
Right.
as per last week, we're almost double what we were at last week, and the climb is being exponential. And I don't think a lot of people could have predicted it. And there's obviously some pundits out there that had anticipated that this could possibly happen. And then when we kind of got to this idea that before we decided that we needed to do social distancing, the people that had came up with the idea of social distancing, I guess they already have this in mind that if we don't kind of stop this spread, that it could be an exponential climb. So I personally didn't see it happening, but I did know that based off of previous data from other pandemics, such as the H1N1, the 1918 flu, swine flu, all of these things kind of had spread because we weren't able to control them. So it's kind of easy to understand why it could happen. But, after history, we've learned from this.
Right.
I mean, I just thought that people would be smarter.
Dr. Kothari, when we are talking about these issues right now where, the expectations weren't to the intensity it was going to get, what are some of the uncertainties and some of the obstacles you're facing, as a cardiologist, as a person who's also on the front line? What are some of those issues that are coming to your mind as I ask you these questions?
So right now I'm actually a general internist. I begin my cardiology training in July, so I'm not a cardiologist yet, but in the process. So in terms of the obstacles, as a frontline person during these difficult times, I'm even surprised that we're facing some of the obstacles that, practicing in the United States. I know the availability of equipment and stuff is difficult to obtain in other countries, but in the US it's not something that I personally have dealt with. And with that being said, things that we hear on the news all the time, like personal protective equipment, the need for that is at an all-time high, and it's probably one of the most paramount problems that we face as healthcare workers. And it's extremely difficult for us to consider examining a patient when we can't protect ourselves.
Yeah.
And if we were to examine these patients, we consequently would put other patients at risk for contracting the disease. And but this is something I feel like everybody across the country is dealing with. And for the time being, most of us are just managing with the resources available. And things like hospital beds, medications, ventilators, all these things are all-time high. And we need all of these things to sort of treat these people. And so that's kind of what we're dealing with right now.
Let me ask you a quick question in regards to that. And that's something that's been asked by media. It's being asked all over. we're talking about PPEs, the personal protective equipment. We're talking about ventilators. We're talking about beds. Necessarily, we wouldn't think we would have this kind of an issue in the United States of America. For our audience that is watching this, could you sort of break down why there is such a huge need of PPE and all of the equipments that are missing right now, and how important that gear is for professionals such as you to treat patients and also to not carry this back home?
So most hospitals, they have a certain supply of things, and they kind of decide how much to order based off of what people are using. It's not every day that you anticipate a global pandemic to come about, and everybody's coming in with a certain illness that requires the same form of treatment. And yes, because this disease is contagious, we healthcare professionals, and that just doesn't include doctors, that includes nurses, that includes the physical therapists, that includes the people dropping off food to the patient, that includes a patient techs that have to take the patients to the bathroom. All of the people that will have physical contact with these people need to protect themselves. Nurses go into the room at least 3 to 4 times a day to give meds in the morning, afternoon, and during dinner time, sometimes even more frequently based off of whatever other conditions these people have. So at any given time, you can have 15 to 20 times somebody's entering the room collectively. So each time you would have to gown up. So just imagine the amount of volume that you would use in terms of supplies. And if you extrapolate that towards every single patient in the hospital, then you can see why the need kind of exponentially rises. So the reason why we have a shortage is because we didn't anticipate this. We didn't plan for this to get to the point that it is. And unfortunately, that's where we are. So that's kind of what we have to deal with now.
May I ask you, and I'm not sure if you're allowed to answer this, but is there a plan moving forward for the next couple of weeks if you do not have enough PPE?
That's a tough question to answer, and I don't think a lot of people have answers to it. All I can say is, based off of my experience in the hospital system that I work in, they're actively trying to procure these items for us. And so far, we haven't gotten to the point where we absolutely have nothing. We're using things sparingly, and we're trying to limit the amount of times we go in there. And if I'm going in there, I'll bring the food in. I'll give the medications. I'll check the vitals. And this stuff, like I said, is done by different people. So we're trying to consolidate the amount of visits to the patient and trying to group things together.
Doctor, I have to ask you, while we are discussing PPE, I have seen all over social media and also on the platform here, doctors appealing everyone to donate PPEs if they have extras, saying how a lot of doctors, a lot of healthcare workers and other individuals have had to reuse their masks multiple days. Your one comment on that, perhaps an appeal you would like to do as a doctor yourself for people to donate their PPEs if it's possible?
We've actually been very fortunate. Me having a social media presence, I've actually reached out to certain people to donate to us, and we've got an overwhelming response, and some very great people have donated to us. So personally at our hospital, we do have an adequate supply of things. As of just today, we got a large shipment from donors. So yes, I do encourage everybody out there to kind of dig into their pockets, whatever they can. No donation is too small. And the other thing is, a lot of times where we're having these shortages is because people within the hospital system themselves are actually taking things to give to their family members and pretty much what they call hoarding on their own. And that's what's also further reducing the amount that we have. And I encourage people not to do that, because the people that really need it are within the healthcare system, not the people that are supposed to be quarantining at home.
That is so true, and I really truly appreciate you giving us a little comment on that. That's something that we're really trying to promote, is the donations of PPE. Again, everyone, try to donate them if you have extra. I want to sort of touch upon another medical subject while we're talking about many things related to COVID. Flattening the curve is a term we keep on hearing. It is associated with social distancing. We understand that. Could you explain what they truly mean by this flattening of curve? And as a doctor, I know the predictions are a couple of weeks, maybe months into it, but what will happen exactly during this flattening of the curve?
Okay. Well, I could explain this in two ways. I'll kind of do it the science way and like the more easy to understand way.
Go for it.
So from the science perspective, the curve everybody's really talking about is the projection of number of people who will eventually contract COVID-19 over a period of time. So a high curve is pretty much created when there's a steep increase in the number of cases per day and a quick decrease, meaning that either the patients recover or they unfortunately pass away. What a flatter curve it means is that there might be the same amount of cases over a given period of time,
Right.
but they'll happen slower. There won't be that many cases per day. And that's kind of what we're aiming for. Because there's a limited number of doctors, there's a limited number of hospitals, beds, test kits, other supplies, PPEs, everything. So the
Right.
nation's healthcare system has a fixed capacity of people that they can treat every day. And that's what we call like the horizontal line. So if you have a high curve, that curve is going to go beyond the capability over that horizontal line. So we can't do anything about that, right? Because we're overwhelmed. So
That's
if we
so
were to
true.
flatten the curve, hopefully we can get it beneath that line and then treat people over time, not in days. And
Wow.
a common sporting analogy that I use is like if you go to a game,
Yeah.
at the end of the game, everybody leaves at the same time and you get stuck in this traffic. Everybody's going to get home.
Yeah.
But if you all just left little by little, you probably won't hit traffic and you'll still get home on time. So that's kind of the analogy I've been using to explain to family members and stuff is come in like when you absolutely need it, not to just show up at the hospital and not to expose yourself to other sick people because then you're going to overwhelm and burden the
Right.
system, which is kind of what's happening right now.
Yeah, and just off of that, Dr. Kothari, you brought up such an interesting point. When should somebody go see the doctors? Right now, there is such an increase of cases, especially in tri-state area. Again, you're in New York, we're in New York. We are seeing cases double nearly every day. Sometimes it's actually more than that. The amount of deaths are also increasing. So, when you're looking at a certain portion of the population, the elderly, the ones that are at high risk, they are currently trying to figure out if they have a cough or if they have a slight fever, do they have COVID-19? Or they're trying to figure out should they go into the ER and risk getting it just to get themselves checked or just go to their primary care physician. Same thing. I'm sure you must have so many patients asking you the same question. What's your comment on that?
So the first thing I like to say, what you're saying is something I deal with on a daily basis, and it's very common. And most thing I think is common amongst all people is fear because of what they're hearing on the news and whatever other media outlets. So I want to let everybody know that being scared is okay, and it's one of the most fundamental human responses during a crisis. And fear is a good thing because it kind of tends to focus your goals and your prerogatives. And I think that once they understand that and they continue to educate themselves, they'll be in a better position. So in terms of patients' symptoms, I would advise everybody to consciously assess their symptoms and see how bad they truly are. If you're a younger patient and you don't have much medical history, not heart history, lung history, cancers, or history of transplants or anything like that,
Right.
you can pretty much watch your symptoms. Is your fever getting worse? Is your cough getting worse? Are you having sputum production? Are you having mucus production? Are your muscles aching? Is it not responding to treatment?
Right.
Maybe over the course of a week, have you noticed that, there's no improvement? Then you might want to go get evaluated. Then on the other hand, there's older patients that do have the history of cancers, organ transplants, high blood pressure, diabetes, lung diseases, and any other conditions that might suppress your immune system. I would probably urge them to go get evaluated by their physician sooner than later, because those patients have a higher risk of decompensating, particularly if their symptoms aren't improving and are progressive with getting worse.
Right. And in terms of talking about high-risk patients, Dr. Kothari, I have to ask you, since we're a South Asian network as well, a lot of the South Asian audience we've had has shown concern with, heart diseases, with lungs, issues with the lungs. We're talking about, other issues with diabetes, with hypertension, with cholesterol. We're a population that's, usually really at risk for these really high-risk issues. Your address to that community, those patients, and no matter what ages they are, they have those diseases. How do you suppose they should take care of themselves?
A lot of the reporting that's been done about chronic conditions in patients with COVID-19 are simply associations and not causations. I want to make that abundantly clear. There's not enough data to suggest that there's an actual correlation between these entities and that they make each other worse, meaning that the COVID makes their underlying diseases worse, or the underlying disease makes their COVID-19 work. There's a lot of these are observations that have been made by scientists that may be fruitful in the future if we were to investigate them more and do further research. My advice to South Asians and any other person would pretty much be to continue taking your medications that has been prescribed by your primary care doctor and keep monitoring yourself for COVID-19 symptoms, as we've discussed previously. But yes, there is an association, and that can't be denied. But it's hard to make recommendations with just the very little research that we have.
Yes, that is so true. And I think that's been the issue of the entire country right now, to just try to figure out what is working out for COVID-19. You know, today the FDA approved the anti-malarial drug that's really been talked about. We've had the administration speak about it, you know, in their press briefings. There are a lot of questions about it. I would like for you to address that real quick as well, if it's possible.
Okay, yeah. So today, the FDA they just approved it recently. So in the hospital, we've kind of been using this medication for the last week or so, or a little over a week. And this is just purely like anecdotal, based off of the mechanism of action and how the medication works, and how it's been tested, you know, on certain patients, and when it began to happen in Wuhan, China. So some of the data that came out at that time showed that it was promising, but we still definitely need a lot more investigation on this medication. But currently, seems to be one of the more promising interventions that we have. And on the other hand, actually, Johnson & Johnson said today that they're going to begin starting human testing for an experimental vaccine, and that's not going to happen until September, and it could possibly be available for emergency authorization and usage as early as 2021. But, you know, there's global efforts are under the way to develop vaccine for a virus. You know, for this particular virus, it's already killed, as of today, 36,000 people. And, you know, but some experts have cautioned us that it can take even more than a year. And it's quite frankly, very just difficult to know when we'll have something. But it's kind of encouraging to see that people all over the world are kind of digging their hands in and doing what they can to help us.
Yeah, and truly, it is a world effort we are seeing right now. But I have to ask you, when we are discussing this, Dr. Kothari, there's so many uncertainties. We're still figuring it out. The numbers are still increasing. How do we truly protect ourselves? I know there is social distancing, but you know, you have me who's working here in a media house right now reporting. You have you who's working as a medical professional, as a healthcare worker. You know, how do all of us really make sure that we're going to be okay at the end of this?
That's a tough question.
Yeah.
You know, right now the data suggests that isolating yourself is really the only way to kind of reduce the spread. We can't stop it, and I think that's something we have to kind of get out of our system. You're not going to be able to stop it, right? We have to just slow the spread and let the disease kind of take its course up until a time we can find a definitive treatment or definitive cure. Because at this time, if we can't treat it or cure it, it's going to continue to spread. So we just have to slow that. And I know we keep going back to the flattening the curve and social distancing, but as per the CDC and the World Health Organization, that's all we really have. And that's the best that we can do.
You know, as a professional, Dr. Kothari, as a South Asian American man, as a South Asian American professional, we're living in a community in which, you know, families matter so much to us, our elderly matters so much to us. I have to ask you, having, you know, parents, having your own family, how has that experience been for you? And I know you come home every night. Are you ever concerned about carrying it with you?
That's a great question. I appreciate you asking me that. From my personal experience with this current situation, it's complicated to say the least. You know, I haven't dealt with anything this in my life. I'm 30 years old. This is the first time I've dealt with something like this. So working on the front line, like you said, I'm definitely at high risk. I deal with hundreds of COVID-19 patients on an everyday basis. And just being younger, I do think I have a stronger immune system. And even if I were to test positive, I may not show symptoms, and there's a lot of studies that show that there's people called asymptomatic carriers. So you might not show symptoms, but you can still give it to other people, and that's what we're really concerned about. With that being said, this has certainly kind of affected my involvement with my family, as my parents are on the older age spectrum, you know, and I would hate to transmit something to them that could potentially have devastating consequences to their health. And yes, I constantly worry about them because there are other people out there that may not share the same hesitation I do regarding social isolation and flattening the curve and hygiene and things of that nature. And these are the people that could potentially affect my parents when they go to the grocery store or go get their gas filled up or whatever they have to do. So with that being said, I haven't seen my family in 4 weeks, and I've avoided them at all costs because I don't want to get them sick, and I unfortunately have to come to work every day. But luckily I do live by myself, so we keep in contact with social media and FaceTime and things of that nature. So.
Yeah, I completely understand that, and I think it is amazing and is brave of all of the physicians and all the healthcare providers and the medical professionals that are working on the front line and have not been able to see their families. I think what you've done is absolutely great, and I think we all need to also understand that. What's the message you like to give out to your fellow medical professionals, healthcare workers, your nurses, everyone that's working around you, 24/7 at this time? A message out for everyone that's in this fight with you on the front line.
So the message to my fellow doctors and other first responders is first and foremost, thank you. I personally know the toll it takes on one's mental and physical health, and I also know that this pandemic could not be controlled without their involvement, compassion, and sort of caring nature. We all have our own family and friends, significant others, but we have to come to work every day to do our job because at the end of the day, we're needed, and there's other people's families, other people's significant others, and friends that are relying on us to be here so that we can get them back home to their families. And it's moments like this that kind of make me reflect upon why I got into this field of work. And it was always to help people. And quite frankly, this is why most of us got into this line of work. And it's like back in the day when people were called to go to war, this is our modern day war, and we're being called up and to be on the front lines to do whatever we have to do to pretty much protect the nation and protect families and friends and things of that nature. And so I want all my colleagues all over the world to know that their work is appreciated and the sacrifices that we all are making are being acknowledged. And at least within our own community, we're very proud of the work that we're doing.
That is so true. We are coming towards the end of the interview, but I have a couple of questions still left, and I would love to go over some of them. Number one question that's definitely coming up right now, there is a mental health crisis happening. People are losing jobs. There's an economic downfall. There is so much concern, and there is an absolute wave of fear that you feel due to COVID-19. I would love for you to address our audience, especially South Asians, that get really concerned, and there's a lot of stress and anxiety about what to do, who to care for, how to care for. Mental health is definitely coming on the forefront as well. Your comments on that, and how should we perhaps practice it better to feel a little bit calmer in the situation?
That's actually a great question, and a lot of people don't really think about this stuff in times of crisis. It's usually always after the fact that it comes to mind. But I firmly believe that mental health is underappreciated and understaffed aspect of the medical field, and the COVID-19 outbreak has the potential to increase stress and anxiety as it's already doing, both because of the fear of catching the virus and because of the uncertainty about how the outbreak will affect us socially and economically. And we're kind of seeing like the trajectory that we're going in, with this social isolation and shutting down the entire country and things of that nature. There's been talk amongst medical personnel about possible PTSD, or what we call post-traumatic stress disorder development during this difficult time, and dealing with stress reactions caused by COVID-19 outbreak can help improve your quality of life and well-being if you kind of approach this anxiety with some good thought. I would advise the community to increase their sense of safety by practicing healthy habits like hygiene, staying connected by keeping in contact with close family and friends, and your mentors. Kind of cultivating new ways to be more calm and practice stress-reducing exercises such as, taking slow and deep breaths, muscle relaxation, yoga, listening to music. And what else people can do is improve their sense of control and ability to endure by kind of accepting that there's certain circumstances that are out of your control. You can't change the things that are happening in the world, You might even have to kind of adjust your definition of what a good day means, you kind of have to consider that the stressful situation in a broader context, and just think that this is kind of the time that we're living in, and we have to make the best of it and look for opportunities to find little successes, even if they're small,
Yes, definitely.
And I think, yes, things are bad and they'll probably get worse before they get better, but rest assured that we're going to make it through this. We're going to come out stronger, and we're going to have learned from it in the process.
Dr. Kothari, currently there are so many legislations, bills being worked on. There is, a great demand of doctors and physicians and healthcare workers from the administration and from other entities of the government to ensure that once we get out of this situation doesn't evolve again. It doesn't repeat again. Would you like to give a call out on everyone that's working out and on this bill, and what you expect as a medical professional once you're getting out of the situation?
You mean in terms of like what we expect to learn from this?
Yes.
Well, I think that in our American history, at least, this is the third or fourth like major pandemic that's kind of like swooped the world by nation.
Right.
And I would hope that we learn a little bit from this in terms of how to avoid certain things like this. I think that on a global scale, we need to have a better sharing of information. I just begin to wonder, like when this first started happening in Wuhan, at what point did they decide, oh, this is going to turn into some global issue? Who should we let know? CDC, World Health Organization. When should we let them know this? So I think maybe dispersing the information a bit sooner, even if it might be a little bit preemptive, would be beneficial. And if it pans out to be not a pandemic, then fine, at least we had a jump start on it. And I think that the people in administrative positions such as the government, they need to be a bit more aggressive about how they approach these things and make sure that the people of the communities that they're serving are well informed. And once again, the people that are in the community now, they need to continue to educate themselves so they can kind of react a bit swiftly if this were to happen in the future again, and continue to educate those people that are younger than them, their children, their grandchildren, whenever that time comes, like, hey, I was a part of this, you know? That's something that I'm going to personally take upon my shoulders, is when I have kids and people that are younger than me, like, hey, I was a part of this. I saw this. And when I'm training future doctors when I get older, I'm going to make sure I tell them about this. Like, I lived through this. I don't want you guys to go through this again, so do your part.
Can I ask you to give a message out to all of the patients you've been treating?
I just want to commend them for their bravery. It's difficult to see this 30-year-old patient, 40-year-old patient come in with no history, and you're ending up having to intubate them and not being able to tell them, I don't know what's going on. This shouldn't be happening to you, but here we are. We're doing the best that we can to help you, and I want to commend you for your bravery. And I want to also kind of reach out to these people's families and let them know that it wasn't their fault. It wasn't something that they could have prevented. This is kind of just the circumstances that we were in. And I appreciate all the support and effort that the family members are providing us with. And there's family members that are actually coming to donate things to us even after a family member of theirs might have passed, because they knew that we did what we could, but this is sort of just a trajectory that the disease took and we couldn't stop it.
Yes, I think you are doing the most you could, and I truly appreciate you for all your works and efforts. Thank you so much for your time here on ITV Gold. Just one last question for you. How is this week planning out for you, and what do you hope out of this week as a doctor?
I stopped thinking about things and long-term goals, because when I did that last week, I was like, oh, it's going to get better, and then the cases doubled. I've started to just approach things day by day and sort of take things with a grain of salt. I've become much more appreciative of things in my life, my family, my friends, and I'm saying a thank you a lot more often, and I'm saying sorry a lot more often as well. So for me personally, I'm just trying to take it, like I said, day by day and learn in the process and try to just contribute and continue to do what I'm doing.
Well, thank you so much for your time, and I hope to have a follow-up with you very soon.
Please, thank you very much. Appreciate the time. Thank you, guys.
Of course. And that was none other than Dr. Janish Kothari. He was joining us from New York City. I hope you learned a lot of information about COVID-19. And again, social distancing is the key. Please stay home, save lives. Thank you so much for joining us on ITV Gold Special Report. I'm Rita signing off.